Hi, my name is Tiana Newby, and this is my clinical test presentation for chemistry lab. So, we were given a patient. This patient is a 17-year-old high school student weighing approximately 142 pounds, taken to the emergency room. He complained to his mom that he felt nauseous, he felt sore, he was having twice a day 4-hour-long workouts for football training. His mother told the ER he seemed confused after coming home from practice. His blood pressure was 145/92, and he's 5 foot 10 inches. So we see this patient who's been working out consistently, working out in extreme amounts, who is nauseous, who is sore, he has high blood pressure, and he's confused. So we can take these initial symptoms that the patient is presenting and kind of assume that there's some dehydration involved. So our tentative diagnosis for the patient is dehydration. We can assume this because of the symptoms that he's presenting. Long and intense workout. He's doing long and intense workouts, which means he's likely not hydrating well enough. His blood pressure is elevated. He is hypertensive. His systolic blood pressure is 145. His diastolic is 92. He's confused, which can be a cause from dehydration, and nauseous, and is sore. All of these kind of go into, or all of these are symptoms of dehydration. So this is our tentative diagnosis. And from there, we decide to do more clinical testing. Some of the clinical tests that we will do from here include glucose testing, enzyme kinetic testing, and urinalysis. So with glucose testing, it's measuring the absence of, or we're measuring the amount of glucose in blood. The absence of or too little insulin in the body results in high levels of glucose in the blood. Too much glucose can result in damage to the blood vessels, kidneys, eyes, and nerves. These patients are considered hyperglycemic. Now, if blood glucose levels get too low, this will result in too much insulin production. Hypoglycemic patients, or patients with an overproduction of insulin, can suffer from weakness, dizziness, and muscle tremors. So 2 ways of testing glucose include a Benedict's test or also using a glucose meter. The Benedict's test can be used to determine the blood glucose levels in the blood, and this will change colors accordingly. So in a Benedict's test, there's a Benedict's reagent containing copper, a copper ion, Cu2+, and it reacts with an aldehyde functional group on the glucose structure, which oxidates it and changes the functional group to a carboxylic acid. In the process, the copper 2+ ion is reduced to copper plus, to Cu+, which forms a red solid copper 1 oxide. So when doing this test, the reagent changes color according to the different levels of glucose, so you can determine the level based on the color that is presented after the testing. And similar to a Benedict's test, or similar to a urine glucose test, a drop of blood is placed on the designated area of a test strip for a blood glucose meter testing. And the glucose in the blood reacts with the glucose oxidase in the presence of oxygen. This produces gluconic acid and hydrogen peroxide. The hydrogen peroxide is then oxidized by a small voltage applied to the test strip. The current generated upon oxidation is measured, and then it is converted into the concentration in milligrams over deciliters, and that gives you your blood glucose measurement on the reading on the glucose meter. And that will give you the reading to then know what your blood glucose level is. So the glucose test results that came back for this patient, the blood glucose meter reading was 115, which is considered normal. The color was blue-green on the Benedict's reagent test. So we can assume that this patient's levels are considered normal because both tests presented with numbers or colors in the normal range. So next to test is for enzyme kinetics. So enzymes increase the rate of reactions by lowering the amount of energy needed for the reaction. They recognize a specific reactant called a substrate. The substrate binds to the enzymes and forms an enzyme-substrate complex. When they are bound together, the enzyme converts the substrate into products, but then it returns to its original state. CK, or creatine kinase. So CK converts ADP into ATP, and adult humans can only survive 1 to 2 minutes without ATP generating reactions. So because CK functions normally only inside of cells of organs and muscles, if there are abnormal levels of CK in the blood, it can signify tissue damage. Abnormal CK levels can be caused by myocardial infarction or heart attack, muscular dystrophy, muscle injury, brain damage, pregnancy, strenuous exertion, advanced aging, anticoagulant therapy, or an overexposure to sunlight. Now we have lactate dehydrogenase, LD. This affects how the body uses sugar in cells, and both a deficiency or an increased amount of LD can cause muscles to break down after exercise. So abnormal LD levels can be caused by rhabdomyolysis, myocardial infarction, muscular dystrophy, AIDS, drug abuse or overdose, alcohol abuse that results in liver damage, muscle injury, cancer, and emphysema. So here are our enzyme kinetic results for our patient. Both the CK and the LD are abnormal. So we can see by their measurements the patient's absorbance rate is not what we want it to be, and both are high. So next, we do a urinalysis test. When we're doing a urinalysis test, we are analyzing the physicality of it. We're looking at the color, we're looking at the contents, we're looking to see, is it cloudy, is it clear, what color is it, does it have particles floating in it, what's going on. And then we also measure the pH, the specific gravity, the ion levels, the ketones, proteins, and the bilirubin. The color and the appearance of urine can be indicative of a person's health. The acidity or alkalinity of urine can also be used as a good initial indicator of respiratory, metabolic, and renal conditions. Specific gravity of urine is used to measure the ability of the kidneys to concentrate or dilute urine. And urine usually comes with some inorganic ions as the body attempts to rid itself of wastes and maintain proper osmotic pressure. But the strength and the presence of these electrolytes in the urine can be a good indicator of renal and endocrine health. In the case of our patient, these chloride ions are high, which we'll see on the next slide. And this can be caused by renal failure, dehydration, another check mark for our dehydration diagnosis, hyperparathyroidism, respiratory alkalosis, or metabolic acidosis. Ketones are the product of fatty acid metabolism and are not normally found in urine. So if we see these, not good. Protein is normally found only in trace amounts of urine. Proteins are a larger molecule, and the glomerulus of the kidneys can typically filter these out so they do not pass into the urine. However, if there is renal disease or kidney damage, this may cause damage to the kidneys, which may allow larger particles like these protein particles to be passed through. It increases permeability of these particles in the glomerulus, which can cause a leakage of protein in the urine. So if there's protein in the urine, there's likely some kind of damage going on there, preventing that from being filtered out in the urine. So protein tests are conducted by boiling a urine sample and then examining it for precipitate. So then bilirubin It's typically only found in trace amounts of urine, and if there's more, it can indicate that there's liver damage or disease, or even anemia. So here are our urinalysis results for our patient. There was no precipitate formed. The specific gravity was normal. The pH was normal. However, we did have an abnormal color. The urine was reddish brown, and we had an elevated chloride ion from the electrolytes panel. The ketones were normal or low. The bilirubin was normal and low. The Ehrlich reagent tests showed no changes. So we see that everything was okay, but the color and the elevated Cl, which can be indicative of dehydration. So as we originally suspected, it appears this patient is severely dehydrated, likely from working out intensively and for prolonged periods of time, and not getting proper hydration. Too much sweat, too much exercise, and not enough hydration to keep that kind of homeostasis of the body. So what we're going to encourage this patient to do is drink more water and more electrolytes, and also we're going to treat this patient with some IV fluids to try and get their levels back to normal before we send them home. And yeah, so after all of this testing, we can determine that this patient is dehydrated, and hopefully this young boy will be sent on his way to continue his football practices. All right, thanks. Here are my references. All right, thank you.